you're only as happy as your saddest kid. And so not only does this affect the person who's addicted, but it affects their extended family. And it was frustrating when I worked in probation and you knew the problem was addiction and you couldn't get the person to bed, or you couldn't get them diverted and they end up locked up. And then you end up using, like you mentioned, Mr. Hines, DOC for MAT treatment. It's not effective because you're in and out, in and out, in and out. And Portugal does kind of the same thing. They've decriminalized drugs, which let's not talk about that right now, but when they find someone who's using, they offer them treatment or they offer them jail. You're doing that here, and you're taking the people who do want the help. What struck me too is getting the people into treatment quickly. I've actually been in that car where you're driving the person to treatment, you stop at a stop sign, and they're gone. That's how you, Dr. Cox, you're nodding your head, it happens. And to have the support staff to have these clients know that they're going to get the type of support to get them into treatment, to follow up and not drop them. You talked about opioids, and one of the gentlemen speaking on the video talked about alcohol. Is it primarily opioids? Is it?
It's primarily opioids, but there's a mix of alcohol, and alcohol has taken a toll on a number of the folks that come into us. And the benefit that we have is we have the opportunity to dose them as well, to using PreTrial.
You talked about there's the judicial component is probation's involved. Is it a 24/7 officer?
It is.
It is, and and if they're not compliant and they get redocketed, how many times can that happen? Or
depending on what they did, Representative Callahan. You talk about the stop sign, right? And somebody jumps out. Well, that's happened to us. I'm not trying to fool anyone. So that person's getting redocketed and probably ending up in the Department of Corrections. But there's other people that have done well for, a month and then have a slip, and they're positive for fentanyl. We bring them back to court. We report that to the court. But the court doesn't lock that individual up. They have a conversation with them, as do we, and we move on.
And this is a pretrial program, but it's also available to people who have records. I can't stand seeing money wasted, but this seems more like an investment than anything else. And I'm hoping you can bring it to your leadership, Representative Walker, and we certainly I will talk to ours about it. And it's a program that, speaking from experience, the frustration of not being able to get someone off the drugs that's causing the behavior. Sometimes it's part of the cause, but it certainly is a major obstacle to people being successful. And when they realize a week later in jail they should have taken advantage of this seems to be the program that makes that happen ahead of time, so they don't have to get convinced after they've been in jail. So,
thank you.
All right, I appreciate it.